already feels to me like we're well into this new year. A lot has been happening already in this year. And I'll just give a very brief update in terms of it seemed there was some confusion by some folks about the mayor had issued a now I'm wanting to say quarantine, but everyone needed to be home by 6 p.m. on Wednesday evening. That ended by 6 a.m. Thursday morning. There was a public emergency issued that lasts for 2 weeks, but that's more to give the government flexibility for any steps that need to be taken in the next 2 weeks. For the rest of us who live in the district, you should pay attention to the news. If you're like me, you got that beeping on your phone when we were told that that we had to be in by 6 that evening. So if there are any updates of that nature, you'll get them separately. I will go ahead and start with the data, and then I want to give people an update about where things stand in terms of vaccinations, because there has been some movement on that. Okay, so first up, total people diagnosed to date with COVID-19 is 347. One thing to note of concern is that we've actually had 349 new diagnoses, because we now have had 2 people who, both of whom had tested positive in April. One of them then, and both of whom subsequently tested negative, and one of them tested positive again in December, and the other one has tested positive again in January. And so what this points to is how essential it is that we all continue to be vigilant, even if someone has had COVID. We do now know clearly you can get it again. DC Health is tracking those cases. DC Health is tracking those cases where someone has a second diagnosis, and so we're providing that information to them. But as I say, so far we have had these 2 where we did have a negative test result, and then a few months later a subsequent positive. So what it points to, as I say, is just the importance of our vigilance about, anytime you're with anyone but your household members, to be wearing a mask, to be maintaining a safe physical distance from folks, to be washing our hands regularly for at least 20 seconds with soap and water, and to just keep repeating those things to people. So in terms of numbers, the kinds of placements, so we have had 6 people test positive who live in a host home, 103 who live at an intermediate care facility, 1 person who is in a mental health facility, 36 people who are in their natural homes, 2 people in a nursing home, 4 people who are in out-of-state placements that are funded by DDA, 33 people in residential habilitation, and 162 people in supported living. So for the sort of the primary kinds of placement that we have, where we've had more significant numbers, in intermediate care facilities, when I look at the total number of people who were there in the year, which is more than we currently have there because we have lost some of those people, but in terms of percentage of the total for the past year, we've had 103 tests positive out of a total of 299, which means that in intermediate care facilities, 34.44% of the people have tested positive. Of those who have tested positive, we have had 19 who have subsequently died, and 12 of those have been confirmed as COVID deaths. And so, of the confirmed COVID deaths, there's been a death rate of 11.65 for people in intermediate care facilities. In natural homes, we continue to have a fairly low number, especially, as compared to, there's over 900 people who we support who live in their natural home, and only 36 who've tested positive. We do get results from the city of anyone who is at home gets Medicaid. So, these numbers do seem to fairly accurately represent the percentages of folks who are in their natural home. So it's a pretty low percentage of people who have tested positive, 3.86%. Of those who we've lost to date, there's been 5. And so the percentage in terms of the death rate for people in natural homes who've gotten COVID, it is the highest of all of those that we have at 13.88%. In residential habilitation, the number to date, as I had said before, is 33 out of, over the last year, 110 people in that kind of placement. And so 30% of the people in ResHab have tested positive. And of those confirmed COVID deaths, we've had 2, and that's a 6% death rate for those folks. In supported living, to date, 162 people tested positive, which out of the total population, which is a bit over 900, gives us a COVID infection rate of 17.38%. And with confirmed COVID deaths of 12 people in supported living, that's 7.4%. And then overall, amongst people supported by DDA, what we've seen is a 14.4% infection rate with COVID, which is 347 total infections out of about 2,400 people. And of those 347, we have 33 confirmed COVID deaths, which works out to 9.51%. In terms of diagnosis by month, what you can see is that since we haven't met in a while, in the month of December, fortunately, we had no infections in intermediate care facilities, which was quite an improvement from the prior month. 2 in a ResHab, 32 in supported living, which was where we saw our biggest growth in the month, and 6 in natural homes, which is also a bump up, as you can see from prior months. The only month that had that many people in natural homes was back in May. And we have not seen this number of people in supported living since April who have tested positive. And now in January, it's very early in the month. And this says 6, and we actually have had 7 to date. When I was doing my data, I accidentally had someone in 2020. So I'll need to correct that by 1, but there have been 6 to date, primarily in supported living. We have seen, the increase in the number of people who've required inpatient care. So in the month of December, there were 9 people who required inpatient care. And in the month of January so far, there have been 3. We currently have 6 people who are hospitalized, including, who've gone from hospitalization to getting rehab at a long-term care facility before being prepared to be discharged home. And now in terms of, we have gotten some update from OCME, and so you'll see the numbers have changed a little bit. So to date, of people who have been diagnosed with COVID-19, 44 have subsequently died. Of those 44, however, and so you can see in December, there were 7 deaths. To date in January, there have been none, I'm pretty certain. Of those 44, we have gotten confirmation that 7 of them were in fact not COVID related. we are still awaiting confirmation from OCME regarding the cause of death for 4. And so of those that are either confirmed or presumed COVID, as you can see, there are 33, and there were 4 in December, which really is the highest number of deaths we've seen since back in May when there were 8. So I need to turn on the chat just to see. Okay, no questions about that. So we had a meeting with DC Health this week to talk some about vaccines and where things are with vaccines, as people may be aware. So there are now 2 vaccines available. And I know we've not met in 3 weeks. So a lot has changed in the world regarding vaccines in those past 3 weeks. We have sent out information. I think we've sent out at least 3 communications, and it's been sort of progressively updating the information from DC Health in terms of people's ability to get access to the vaccine. The first group of people who have had access have been healthcare providers, which is pretty broadly defined as people who have direct or indirect contact with a person who could have COVID. And so that really involves sort of all provider staff who work directly with people or work in a location where they could have contact with people with who COVID, any of the people we support. And so initially, this was DC locations, and initially it was just ICF and ResHab. It was expanded beyond that to include all healthcare providers who provide support to the people supported by DDA. And this week it was further expanded that it's all healthcare providers, which is that expanded definition. It includes DSPs. It would include the Q who is working on site. It would include the executive staff from the agencies who I hope are going on site in the places where you support people. So if you as a provider are going out into the home, then you also would be included in those people who are healthcare providers who would be who are able now to get the vaccine, who care for any people, any district residents. And that includes some of our providers who are in the close-in suburbs caring for district residents. So that's our first full wave. Yesterday or day before yesterday, we sent out communication to all of our providers who have people in ICF's intermediate care facilities and residential habilitation placements that they are the next group up that will be vaccinated, that can have access to the vaccine. What we are doing is that by next Wednesday, we need to provide a list to DC Health of the locations of all of these people and the number of people at each location so that an assessment can be made of where those folks will go to get their vaccine, and also identify for people who will have a barrier to going out to get the vaccine, sort of who that is, what the barrier is, so that we can make plans for how that person can be vaccinated. We have some folks who may not be able to leave the home for a variety of reasons. And if that is the case, then we would need to work with you about who the provider would be and how we could get vaccine delivered to that person. And so what that means is working with the person and whoever has health care decision-making authority to determine their interest in getting the vaccine so that we have a clear number of people who want to get the vaccine so that we can plan for them getting the vaccine the following week. That's the week of the 18th of January. So what I think we all need to be aware of is how challenging this whole project of planning to get vaccine for, I mean, the district has over 700,000 residents. Vaccine can't be provided to people under the age of 16. So I haven't looked at census data about how many people we're talking about who are 16 and older. But beyond that, we've also got all the healthcare providers who come into the district from the surrounding jurisdictions. And so these hundreds of thousands of people, and then, as we all know, there was an original number of vaccines that were expected, and then there was a number that arrived. And so DC Health is having to make an assessment of sort of how they open these vaccines up a group at a time based on the amount of vaccine they have, keeping in mind everyone has to get 2 doses, and the percentage of people who are then, once it's been opened up to a particular group, how many of those people are going to follow through and actually get the vaccine. So that is quite a project. So there is a meeting, a telephone call each week where they provide us an update on where things stand. And we've also had some individual conversations with them. And so that's where we stand in terms of people that live in intermediate care facilities and residential habilitation. The other thing people should be aware of is that as of the end of next week, people 65 and older who live in the district or district residents 65 and older. So for folks supported by DDA who are 65 and older, regardless of the kind of placement they live in, the vaccinate.dc.gov site will be available so that they can log in and register to get a vaccine. After that, we will be looking, or DC Health will be looking at people with underlying health conditions that place them at risk of serious outcomes from COVID. I haven't gotten, and Karen is with us today. She might be able to give us more. Karen from DC Health. She might be able to give us more information about this. Who makes that definition, like exactly how the determination is made and how someone will register at that point. I'm not as sure yet, but it sounded like they are expecting for that group to begin being able to register to get vaccine by the end of January, which will then be available at the beginning of February. There will also be at that point availability for some essential personnel, and which essential personnel will be communicated at that time. As I said, I think the challenge is as each group opens, they have to see how much vaccine is available, gets out there, and then the clearer definitions moving forward go from there. For the folks supported by DDA who are in supported living or living in their natural home, they will really be treated as any other district resident in that if they are 65 or older, they can register next week to get the vaccine. If they have underlying health conditions, that will be available for them by the end of, to register, we expect at the end of January. And for other folks who are, otherwise healthy, no other issues, I expect will maybe waiting a bit longer. I think the important thing, so in terms of people in intermediate care facilities and residential habilitation, that was about 400 folks for us. When we start looking at the people who are in supported living, that's over 900 people. And people in natural homes is over 900 people. What's really important is for provider agencies that support people in either of those settings to begin talking now, and hopefully you've already been talking to people, to the healthcare decision maker, about their views about the person receiving the vaccine. So that as soon as we say it's now open to this group, you can go in and register and get them access to the vaccine. So that is where things stand and what we know about vaccines so far. Okay, so there's a comment here, and I think Karen is here and can respond to this. And I heard this same thing the other day and heard the answer. So if Karen's not here, I can take a crack at it. Someone is saying, I'm finding that many of the locations listed to provide the vaccine are not available when I attempt to schedule an appointment. None of the health clinics have been available since we received notification that we could not register or could register. I found a few appointments for Safeway locations, but there are some issues with confirmation. What is DC Health doing regarding availability of appointments?
Hi, Director Reese, this is Karen. I'm here.
Very good.
So first, good afternoon. And Director Reese, thank you so much for just kind of highlighting those specific points and just making sure that everybody knows that this is an extremely complicated process. And the prioritization is months of planning and things like that. So we want to ensure everybody that's on the chat line that we're working really hard to make sure that this process goes as smoothly as possible. As far as the limited number of appointments, that is kind of one of those things that has evolved over time. We at first anticipated a certain amount of appointments at the certain locations, but practically we wanted to make sure that it was feasible to have people vaccinated and be able to have that observation period of 15 minutes still being in line with social distancing and making sure that it was staffed with the appropriate amounts of healthcare providers to attend to people that were having vaccinations and having that observation period. So we are seeking new points of distribution. So we're looking for that. We're opening up new points of distribution. I think starting next week, there will be several other points of distribution that you should be able to see on those scheduling lists. I know that some people, when they do go on to the vaccinate.dc.gov, you're sent an email with just a place, time, and date where you're going to receive the vaccination. But I'll be honest that I don't know all the I guess emails and responses that you get when you do those when you do that registering. So as far as what DC Health is doing, we're just making sure, one, that it remains safe, two, that everybody gets vaccinated in a timely fashion. And just a caveat point to that is that DC has been ranked one of the top 10 places in the United States as far as vaccine administration. So just putting that out there, that we are actually doing an awesome job with making sure that people are vaccinated. But I'm hoping that the process will be a little bit easier going forward, and starting next week, since we're opening up to a larger population, we can anticipate that there will be some delays, but hopefully it'll be a little bit easier for everybody.
Thank you. Next question, given the spike in COVID cases in supported living, it says who are often living in crowded settings, is there a possibility of their qualifying to register sooner than the end of January? No, that was raised, given that there's 930 of them. I did raise that question because the only thing we could do sooner than January would have been to have included them with the people in ICF and ResHab. And the number was too high, given that they're also opening it up at that same time to seniors. If you recall, I said at the end of January, it's people with underlying health conditions that place them at higher risk. I am going to be revisiting the question of whether we could include all of supported living at that point in time. But at this time, the end of January is actually kind of the best case scenario for people in supported living. What I would say is that it is essential that people just continue. This is for staff and the people we support. Continue to be cautious with complying with the PPE. Making sure that you're using the face coverings appropriately, keeping a safe distance, being very careful about engaging with people outside your household, and washing your hands regularly. And, we do still have a long way to go. And unfortunately, the amount of vaccine, it is coming in at the rate it's coming in. And so the city has to make determinations over the whole city about how it gets released to different groups. And the view was that there was more concern about the serious outcomes for people in the residential habilitation and intermediate care facilities. While it is true there are people who live at home who have just as serious underlying conditions, at this point, it is just those larger congregate settings that are included. So this is a statement, and I'm not sure I understand it, so I'm hoping that Winslow can respond, or perhaps we can get some more clarity about it. It says, we hope service coordination will be involved with the IDT members of each person so that there is a smooth vaccine procedure.
Yeah, so as historically, service coordinators are often considered the drivers of just about every aspect of a person's life. This, however, is a healthcare matter and should be considered in the same fashion as a flu vaccine. And I'm pretty certain that service coordinators are not involved in decisions as to whether a person gets a flu vaccine. So the actual procedure in terms of how vaccine is distributed is being managed by DC Health. We are supporting them in terms of ensuring that they know what our target populations locations are and what settings they're in. And so I think to another question about natural homes, as Director Reese stated, natural home distribution will be in similar fashion to every other citizen. If a person is 65 or older, they'll be able to register when that group opens up to register. If a person has conditions as defined, yet to be defined, I might add, then you would be registering when the group that fits the criteria. And in terms of whether a physician's note is needed to verify those pre-existing conditions, I would have to defer to DC Health.
So I think this is a response as much as it is a question. It says the Vaccinate DC portal is not working properly. I'm not sure that's an accurate reflection, but anyway, we attempted to make appointments after registering and selecting a location. There's no appointment left at that location, or when Safeway vaccination site accepted to make the appointment, they then received a message, there are not enough vaccinations to fulfill this appointment booking at this site, and the confirmation was denied, and then they had to start all over. So it isn't that the site isn't working. It is that when you go in, you select a site, and that ultimately when you get to the confirmation, that site might not still have adequate vaccine for all the reasons that Karen was just saying about making sure that they're not doing too many at one time, because people need to, it needs to be a space where people can maintain a safe physical distance while they're there. They have to stay there for a period of time to be observed after receiving the vaccine. And I understand that this can be a little frustrating, but there is vaccine. So it does mean, I'm reading this as sort of instructions to someone. It does mean that sometimes you have to go back and do it all over again. Can you clarify when home health aides under the state plan and EPD waiver will be vaccinated? When will EPD waiver recipients be vaccinated? So home health aides are included as healthcare providers. And EPD waiver recipients, I assume, are considered, and maybe I should just be deferring to Karen on all this. EPD waiver recipients would be, they live in their home. They would be considered as any other district resident who lives in their home. If the health condition they have qualifies as one that places them at higher risk for serious outcomes, then they would be included in that earlier group. If they are part of the elderly and persons with disabilities waiver and are elderly, being, well, if they're 65 or older, I won't call that elderly anymore. If they're 65 and older, then they could register starting next week. So about 10 days ago, there was a plan on coronavirus.dc.gov to please people over 75 and place, I assume, over 75 in category 1B with those 65 to 74 in category 1C. I would like to know why that changed. There are many very healthy people, such as myself, in the 65 to 74 age range. Karen, perhaps you know why that changed. I will say that you'll notice that the plan that is on the website does say draft, and the plan, while the written plan on the site may or may not change, the plan evolves as the facts on the ground evolve. And maybe, Karen, you know why it is that the DC, because I do know in other jurisdictions, the age is first 75 and older, but in DC, they've chosen to start at age 65.
Yeah, I don't know that I know the specific rationale why it was changed, but I just want to remind people that the older you are, no matter how healthy you are at this point, you are at a higher risk for developing more severe symptoms if you are exposed and contract the coronavirus. The other thing is that because originally DC did not anticipate getting the amount of vaccine doses that we currently have. So we have been fortunate enough to receive some vaccinations from our neighboring states, Virginia and Maryland. So we have, I would say, a lot more than we anticipated. So in a spirit not to waste any vaccinations and to make sure that residents are vaccinated in a timely manner, those people were added to this initial phase of vaccinations.
The next question, I'm not sure it's been answered yet, and maybe Karen knows. And I will admit I was much more focused on just our next two steps than I was on this step. But how will DC Health determine who qualifies as having underlying health conditions that place them at higher risk and able to register, and what sort of documentation will be required for that?
That's something I'll have to take back to the committee team. Since we don't have that portal open just yet, I don't know the specifics on that, but I'll take it back to the team and hopefully I can provide you an answer at a later date.
And as I say, you know, this plan is evolving as the facts of how much vaccine is available, how much is being used, as all those facts continue to evolve. And so as we get the updated information, we'll share everything we have. Forgive me if I missed this in the comments regarding scheduling, but for a healthcare provider who's had their first dose, they have not all received follow-up from pharmacies regarding the second dose scheduling. They're not able to sign up through vaccinatedc.gov. Pharmacies give a variety of responses at the time of the first dose, such as use the same website to come back to sign up, just come back in 4 weeks. We're directing healthcare providers to continue to follow up with the pharmacy that they started with. I will say that this information was provided to us about a specific provider that we did forward to DC Health. And so, Karen, if you have any specific response to that issue, because I have heard from people that they don't. When I first heard about the vaccine, I sort of recall this image of a person getting a vaccine and at the same time an appointment card to return for the second dose. And I've heard from people that they're not clear about how the second dose is going to work.
Director Reese, I've also heard the same concern. I will say that it's kind of a mixed bag because I've heard that with the card that you get, it's like a 3x5 card that you get that has the lot number and your name and date of birth and everything, that you are receiving appointment at that time. I would probably suggest seeing if you can make an appointment before you leave. But of course, I'll have to defer to Dr. Shaw and see if there has been any resolution on that front. And again, I'll report back whatever the findings are.
So we've heard about this regarding Safeway. I think that's the correct one. And we communicated that to Dr. Shaw. So if people hear about this, about other specific providers, please let us know. So next, my son and others in supported living are at higher risk than many in the 65 plus age group. I certainly understand that. I think there are people who, there are lots of people out there living at home who are probably at higher risk than a person just because the person is 65. Unfortunately, there are lots of decisions that are having to be made about how you roll this out and about sort of who fits into which priority category. And at this time, we could just communicate sort of where things stand, which is, starting next week, it's 65 and older, as well as we need to submit all the numbers of people who live in intermediate care facilities and residential habilitation. And after that, we'll be having more conversations about them regarding the other people supported by DDA. Just as a reminder to people, if you're going to type a question in the chat box, you have to scroll all the way down to where it says everyone. Because when you first open the chat box, what shows up is all attendees. And it may sound odd, but we're not considered attendees. And so those of us who could answer your question are not going to see it unless you scroll all the way down to where it says everyone and type your question there. What support, if any, will be provided to people in supported living and natural homes to get the vaccine if they cannot easily leave their homes to get vaccinated? So we have already talked to DC Health about this for our first round in terms of people in intermediate care facilities and residential habilitation. There are some providers that are available to go out to give a vaccine. And so we will be following up as we roll out, for example, with intermediate care facility and residential habilitation. One of the questions we're asking is, are they interested in it and are they able to go out to get it? And so for people who are interested and not able to go out, we'll be following up with a healthcare provider that provides vaccine and can go to their location. And I expect as we get down to supported living and then natural homes, we'll be doing the same kind of thing. So I understand the decision, but I believe that supported living residents and others under the waiver are a small enough group that they could easily be put ahead of healthy 65 to 74-year-olds. I will just say that when I presented that group as including 930 people to Dr. Shah, he didn't hear that as a small enough group. The decision to include 65 to 74-year-olds, I can't answer completely about how that decision was made. I expect it may have been made based on the data in the district about outcomes for people based on age. While I know nationally it may be that 75 and older, it could be that the age in terms of serious outcomes was more significant in DC starting at age 65. I don't know. I would have to ask Dr. Shah about that. Perhaps this question has been asked, but is the vaccine compulsory? Most DSPs within our agency have declined to be vaccinated. Is there simple information we can share with DSPs to give them a better understanding of what to expect after taking the vaccine or to address their concerns? Would this information be on the DC Health website? So first of all, I'll say that we sent this information out to, so we have information that we sent out to the directors of nursing across all the agencies about what to expect after getting the vaccine. We were sending it out thinking about the people we support, but it's certainly true for the staff as well. And we also sent out some information when we sent out the notice this week that all provider staff could get vaccinated about the vaccine. And I believe, and Karen, maybe you could remind us where it is. I'm pretty sure that on the coronavirus or on the Vaccinate DC section of the website, there is information about the vaccine, if I'm not mistaken.
Yes, there's actually a vast amount of information on coronavirus.dc.gov/vaccine. And if you just go to coronavirus.dc.gov, in the headers, if you just click on vaccine, you can get it that way as well. There are frequently asked questions. There's information on the vaccine. There's a lot of information that's actually been recently updated. So I do encourage everybody to go and seek that information.
So if DSPs or other staff decline to be vaccinated, will they be permitted to continue working directly with people DDA supports? As I said before, the vaccine is not compulsory. One of the things I think to keep in mind, and Karen, please correct me if I'm wrong here, but the vaccine in this instance, so wearing a mask protects you and protects everyone else. The vaccine protects you, which is why it's very important that each of us, as we are able, gets the vaccine. It is very important to continue wearing a mask after, because what the vaccine prevents is serious outcomes from COVID. It doesn't prevent you necessarily from contracting the virus and not having not becoming very ill. Just like when you get the flu vaccine every year and you still get the flu, and it may not be just the same, I shouldn't say that. But the important thing is, one, no, we cannot say to staff that this vaccine is compulsory before you can work with people we support. But secondly, what's very important is even once people get the vaccine, they need to continue proper PPE use until further notice.
Hey, Director Reese, just to add on to that, we actually had a training this morning with our epidemiology department. A lot of you may know Daryl Hawkins, who gave a really amazing comparison from the vaccine to airbags in a car. Even though you may have airbags in a car, it does not stop you from getting into an accident. It also does not mean that you should not do your due diligence at not following just normal street signs and speeding requirements and things like that. The vaccine is just, as you said, that layer of protection that will aid in not developing those serious effects of the vaccine. Of COVID-19. So if you look at it like that, again, you still do have to follow all the protocols. And Daryl, I think, might be on this call, and she can explain it a little bit better than I. But
that was
I just thought that. Yeah, thank you, Daryl.
Yeah, and I want to just, as a plug, and hopefully most of your DSPs will take this vaccine again, and also the person supported when they're able to, but continue to do, just because your DSP is at a location all got the vaccine does not mean that you stop screening them for symptoms. You still must continue to do all the things. They must continue to do the universal masking, universal eye protection, if required, per DC Health guidance, and all the infection control and prevention. And as Karen perfectly summarized that analogy. At this time, we don't know if it will prevent you from getting COVID and spreading it asymptomatically. We're just not sure. What we do know from the vaccine, as Director Reese and Karen already mentioned, is that it will protect you from serious outcomes. And so that's great. I think that's fantastic news. It's a good reason to get the vaccine, even with that information available. But until further notice, we have to protect everyone else around us. Like Karen said in that analogy, we still have to drive safely on the road because we don't want to cause other people to get in a car accident and them get injured if they're not wearing their seatbelt. If they're not vaccinated, they can still have serious outcomes. So let's just continue to do the infection control prevention and guidance as we've been doing. So thanks.
So it is like the vaccine is just one additional preventive measure we have to take. We don't take anything else away.
Anyway, so hopefully we'll find out more. So let's all be optimistic. But for now, let's be careful and protect each other and our person supported.
And it does continue to be true about this, that as time passes, we continue to learn more. So if people need documentation to support that they're at higher risk, it would seem that they need to get some documentation now. If they want to be able to timely register at the end of January, it can take time to get that supporting documentation. Unfortunately, perhaps next week we'll have more information about what that is going to look like. Totally anecdotally, I happen to know from my own doctor who has sent out an email to every patient in his practice that he's registered to get the vaccine, and that as it becomes available, he'll be in contact with people and he'll identify who it is that's eligible to get it. I have a really good primary care physician. So, we will be getting information about exactly how this is defined and what, if any, documentation is required in order for people to get the vaccine. So far, for example, up until this day, it has just been healthcare providers who have been able to get the vaccine. And what they have had to provide, and people may correct me here about what they even needed to show when they got there, but what they were told they needed to provide was just like a work ID showing that they worked at some healthcare facility, which would include any of our provider agencies. And so, I don't expect this to be some burdensome documentation process. But as it does open up for that group, we will get more information. So will DDS Health and Wellness be preparing an educational COVID vaccine 101 information handout for healthcare decision makers, healthcare providers, so that they may be able to make an informed decision, as many are high risk? So we did send out information about the vaccine, and I don't know, I don't believe Winslow, good. It looked like Winslow was going to speak, so I'll stop.
So at this time, Health and Wellness is not preparing any type of educational video. I put in the chat box the information that is being provided by DC Health. It's not as complex as some of the issues that decision makers need to have information on. So essentially, it breaks it down to a point like, what is a vaccine? What does a vaccine do? Why do I need this? What's going to happen after I take it? So no, we won't be. And the main reason why we won't be is that I think the information is very succinct, and to the extent that a person doesn't understand the information, I'd ask that they reach out to the health and wellness nurse, and then we would support any effort in terms of explaining to you what the vaccine is, what to expect. It's very similar to a flu vaccine, and I'll defer to Daryl and Karen, who have the ability to kind of use great analogies, but the vaccine is not going to stop you from getting COVID. It will lessen the symptoms if you get COVID. You still, as was stated before, have to take these precautions. I'm not really certain what information would need to be provided to the healthcare decision makers. I can tell you that generally people have expressed concern about this vaccine, and this is why we have leaders going in and having the vaccine and making videos to show their staff. We have a couple of providers that are actually worked out really creative ways to incentivize their staff for taking the vaccine, and their staff are willing. I believe that if a leader of a provider takes the vaccine and his leadership team or her leadership team takes the vaccine, that will move forward in a great way to show others the safety of the vaccine. This is not, this should not be as heavy a lift as I think people would believe it to be with regard to administering a vaccine. Once we get rolling, I think we're going to be fine. But the education piece, you've got nurses. I would assume most of you have nurses on your team. The information that was provided in chat, if they don't understand that, then they can reach out to the health and wellness team. And I could have had Michael available, but Michael's one person, and to wait for him to develop an educational video when the information is already there, I don't want to, as Director Reese said, we'll be moving quickly in the next couple of weeks. Thanks.
So there were a number of questions submitted on behalf of the DD Council. Please ensure that all those questions were received and that they are answered. They were all received. I don't want to, we have like 2 minutes left. I don't want to walk through, it was like 25 questions. I think I've answered them because they were questions sort of about each different group and what kinds of plans we have and, you know, where they are in the queue, so to speak, and what arrangements will be made for them. And I believe I have answered all of those. There's a question here, which I'm going to sort of punt to people who are here because I know a lot of folks here have gotten the vaccine. So what verification does a DSP or a Q need to bring with them to be able to get the vaccine? Is a letter on company letterhead verifying that they work with a person served by DDA, is that adequate? And if someone who's gotten the vaccine can say what they had to provide when they got there, because I have the impression that just an ID showing, you know, I work for National Children's Center or RCM, or, you know, I work for this provider, it is all you need. But if someone who's gotten it could tell us what they had to provide. Oh, but see, you went to Bread for the City, so they knew that you were a provider. If someone who went somewhere else, someone said they didn't have to provide. We sent a letter on letterhead, but it wasn't reviewed because the employees, because the employees don't have ID that shows where they work. So they sent a letter on letterhead, but the provider didn't, the folks administering the vaccine didn't even look at it. They asked afterwards because they were interviewed by the press. So people can read these responses. They will ask you for your insurance card. The vaccine is free, but to the extent that they charge for administration of the vaccine, I think that's expected to be picked up by insurance to the extent it can be. Oh, here's so this is for, so once you are vaccinated, if you're exposed to COVID, do you still need to take the PCR test? Daryl?
Yes. So taking the vaccine will not make you positive on a COVID-19 PCR test. There is not, experts are still looking into whether or not antibody tests can be used, but we never, for DC Health, we don't use antibody tests to determine current infection. So if you are positive with a PCR test, that is not from your vaccine, that is from the COVID-19 virus. So that's a common question we also get. So to be clear, the vaccine will not make you positive on the PCR test for COVID. The virus will. The vaccine is not the virus. The vaccine makes your good guy bugs, what I tell my kids. be able to quickly identify a portion of the virus so that if the virus does enter your body, it is trained to attack it better. So again, you will not have a positive COVID test from your vaccine. If you have a positive COVID test, we continue to treat that as a positive COVID test and do all of the things that we would normally do from previous things.
So like in every other way, it's just one more measure of prevention, but nothing else so far has changed. This asks, is it possible that DC Health and DDS can coordinate with our provider physician to receive the vaccine? It would be convenient for our people who they'd have less exposure if they could go to their primary physician's offices. From my understanding, and Karen, you may know, but you only work with all of us. As I said, this is very anecdotal, but I know that DC Health has put something out and that my own primary care physician has been in touch with them. And so that has happened by DC Health. And I also know that there's been no follow-up beyond, we'll get back to you. but they are gathering the names of the physicians in the community who will be able to administer vaccine in their office. And maybe you have other updates about that, Karen. I don't know.
I don't have anything further. That's it.
Yeah. So that's really, your physician likely would have heard from DC Health. And so you may want to follow up with them. Oh, a non-vaccine question. Nice. Maybe. When can people who have DDS as their rep payee expect to receive their stimulus checks? I don't know. I have not heard anything so far since the battle about how much the stimulus check would be, about when they're coming out. And Jared, maybe you've heard an update about stimulus checks. I don't see Jared in the panelists anymore. As we know more information about stimulus checks, we will provide that information. So it is just about 1:05. We heard the questions. As I said, I believe I got all the DD Council questions. If there are, if you want more information, just let us know by email during the week. We want more about this question, and we'll be happy to give, more information then. It would actually be most helpful if you could tell us that by Monday, because there is the phone call, and it's possible that we could raise that issue at a citywide phone call that happens each week. But for many of the specific questions, I prefer, if Karen and I are able to directly just ask Dr. Shah. But if you can send us those questions early enough so we can try and have as complete feedback as we can provide. As I say, this is an ever shifting, the ground is ever shifting. And so DC Health is working really hard to keep up with it and to move the vaccine out to the people as fast as they can. So someone has provided an update here just saying people with direct deposits began receiving $600 on January 1. Paper checks will be coming in the mail, and we'll provide an update next week about what that means for the folks we support. So thank you. Have a nice weekend, everyone, and stay safe. Thanks. Bye-bye.